goals that were developed, short-term and long-term goals that were developed, were not developed by me.
You were gifted.
They were gifted to me.
Oh, yeah.
And so I am asking for an open mind as we move forward through this. Because I'm not scrapping the goals, we're just having to get back to basics. We've talked a lot about that. So, that's kind of the background of goal setting when we're looking at it from, I got the Q3 memo. You'll have comments from me on that. It's like background, these were set before I got here, before we had a full new leadership team at DHS, before really someone was in place looking at things. And so one of the things that I want to say is that in my mind for DHS and what is being driven, my mind is being driven by the state and the feds right now, well, always, is that we need to do the things that they tell us to do and do it well. So, I'll give you an example. Before I started here, our timeliness measures for economic security, which is our team that does all the application assistance and processes applications and stuff, was at below 60%. We are now at 100% in terms of timeliness. And so those are things that we have prescribed goals for DHS, right? And I think that over the years we've deviated from that core of those prescribed goals that has gotten us down the path of A, being in trouble with the state, and B, the community being really not happy with us. And so as we're going through this today, it's not going to be fun and frilly. It's just going to be like an assertion of this is what we're supposed to do as DHS. And these are some of the things that we have to navigate over the next couple of years. Okay. Cool? Done. Who's the new person in the room?
Rachel.
Oh, you did? Okay. Don't ever wear a suit jacket in here.
I know. I love it. It's
I'm
my
sorry, I didn't
Scottish
see it.
jacket,
It's
and
gorgeous.
it's
I'm
my
Laura.
favorite, and I'm regretting it. So like, how am I gonna wash this wool?
My hopes and dreams for more comfortable chairs keep getting shut down, so I'm just gonna apologize now for that, but someday I'll make it happen
Okay.
when we can get a little bit of budget for it.
Well, welcome, Rachel.
Thank you.
These guys have already heard about our statutorily required programs. These are our statutorily required programs with DHS. And so, again, getting back to the core of what DHS is supposed to be doing for the community, this is what all of our funding is tied to, right? I think our budget is what, 3.4 million in some change. And most of that money is coming from federal funds. We talked about that a couple of months ago, about 70% of that comes from feds. So these are the things that we're supposed to be doing with that money, right? Cool. Alright, we're gonna talk about current pain points for the department. We have a lot of them. We're in the midst of having to implement new things that usually take 2 years to implement when there's these significant changes. And that is a statement by the state. So, new work requirements coming through with SNAP. So it's expanding work requirements to, families that haven't had to meet the work requirements that now do with children with age 14 and above. The pain point for us as a department is that's a whole administrative change for us. We now have to verify those work requirements, where in the past, we had a kid under age 14, we didn't have to, right? It actually has not been, these work requirements have not been programmed into the state's CBMS system yet. However, we're supposed to start it November 1st. Yes.
I thought it was supposed to be January 1st.
No.
Oh, Lord.
So, November 1st, we're supposed to go live with these changes. And it is going to be a CF problem. So we are anticipating, it not coming across to our
Oh, okay.
not coming across well to us in a pretty package.
Yeah.
Because it's not just a rule issue, it is a programming issue.
Yeah,
The state received the rule guidance on October 3rd, so there we go. Our team, whenever they start the training, which hopefully will be next week,
Yeah.
well, I'm giving them a little bit of time. They will start the training and our team will be intensely trying to figure that out. I expect a 3-month challenge for us. We're not sure exactly what that workload's going to be in terms of adding in new work requirements, ongoing verifications of those work requirements, which are actually pretty challenging for us to manage just as it is. But that is one of our current pain points.
Oh my god.
But
Well, I was just about to ask what is the consequence of that, and you literally wrote it up there, and it's significant.
yes. So, what's also awesome is our match that you guys have been prompted, that we will potentially have to pay in 2027 for SNAP benefits, so that $1 million that we distribute to those eligible each year, which by the way, we only have 56% participating in the program here, so if we had 100, double that, and that would be 200,000 that the county would be coming up with. So that match rate, right now, if we're looking at our error rate, so that's boo-boos on the state side or boo-boos in our office with administrative and eligibility. If right now we're at 9%, with a 9% error rate, we're looking at a 10% match. If we go above 9%, we end up with a 15% match, starting in 2027. And so we are complicating the system
Mm-hmm.
and yet giving us less money to actually do the job, which is 0.4.
Wait a minute, 0.4 what?
So that bottom point,
Oh, 0.4. Oh, sorry, yeah.
They're reducing our program administration dollars by half. The expectation is for us to implement all these new rules, and if we don't implement them correctly, we have to pay more money.
it's like you're being set up to fail.
100%. They're trying.
Yep.
I have political things to say about this. Did you build this into the budget?
Yes.
I'm sorry.
The thing that I want to note though is that for 2026, this is not gonna be a huge hit for us because it's going to, the reduction in program administration funds are only gonna hit in the last quarter of 2026. That's what we accounted for. So you are going to see a much bigger ask from me in 2027.
Mm-hmm.
Cause we get a full year of that 50% reduction, plus a full year of that 10% match
Mm-hmm.
on the SNAP benefits.
Mm-hmm. That's also when Medicaid is gonna hit is 2027, right?
Yes, correct.
So 2027 is gonna suck.
Yeah.
Yeah, okay.
Okay.
Maybe don't get reelected.
I was just gonna say, well, we can have fun with that guy's
Just
amount.
skip that whole thing. Will I remain?
Okay. Any questions on that?
Are you saying it's $57,000 a year, or next year it will be $57,000 in that fourth quarter?
So in
During-
next year it is a quarter of that.
It's a
loss.
quarter of the 57,000?
Yeah,
Okay,
So this
that's
is-
a total.
that's
Year
the
over year.
total
Yeah.
year over year loss, so take a quarter of that 57,000, cause we're only looking at 1/4 of the loss.
And that, just so I understand the operations, that SNAP program, you've got people across. Multiple people are administrating that, so that's over
Yeah.
multiple positions,
I
right?
have 6 people.
6, thank you.
Yeah.
Okay.
So those 6 people are, they do SNAP and Medicaid.
Hmm.
Big counties, they have a SNAP department and a Medicaid department, well, we wear multiple hats.
Yeah.
And so our funding for currently, we're looking at it today, our funding for, economic security program administration is, only funded at 80%. Alright, well, yes, only funded at 80%. And HICPUF, Medicaid pays for half of that. And then, CDHS pays for the other half of program administration dollars.
Okay.
We are looking at a 1.6%, which doesn't, it's not a lot, but it's still, we keep adding up these things that we're losing. We are looking at a 1.6% reduction in our HICPUF, program administration funds starting this month. And that is because of the state deficit. They took the state deficit, a third of the overall state budget is HICPUF. So they gave a third of that deficit to HICPUF to make cuts. And we're inheriting 1.6% of our allocation is being reduced, starting this next month, or this month.
That's like the federal government's clubbing you over the head, and then you're getting more paper cuts.
Yeah.
I was gonna say just like that, paper cuts, but some of these are way more heavy than little.
Let's just say we
Yes.
like to have fun in different ways. This is not.
And it's a state issue, it's like it's a perfect storm of the state and the feds.
I have some things on that.
Okay.
We have proposition, it's not, proposition MM is what it is.
Yeah. Spent money towards
Yes,
healthy lunch.
yeah, but also it's supposed to help us with some of this loss in the SNAP program administration funds.
Interesting.
Yeah, we don't know how that's gonna shake out, but if that gets passed, that is my biggest frustration is that you look at other states that are facing these same issues and they have because of,
Tabor?
yep,
Yep.
I didn't say it,
Every time. It's Tabor, it totally screws us.
they have more of a way to respond
Mhm.
than we do. So that's why this has been such a,
To get back from other places, our hands are tied
Yeah.
all over the place.
okay, continue. Alright, continuing current pain points, okay? One of the things we don't have our full pulse on because the state hasn't really told us, cause they don't necessarily know how to pull the information out of the system to know what the true impact to us is going to be, is that the implementation of new Medicaid requirements in, 27, so it's really along the lines of our expanded population of Medicaid, so those are typically single adults that are on expanded Medicaid. That's to the tune of over 700 people in our community are in expanded Medicaid. So
So
we're from,
maybe over 6 people.
Huh?
Over 6 people? You got 6 people doing Medicaid in your.
yeah.
Yeah.
well, we have 40% of our population on Medicaid.
Right.
So that's 280, it's actually 37%. But of that 2,080, 700 of them
Or an expansion.
yeah,
And I'm saying you have 6 people to
Doing
handle
yeah, plus
Medicaid.
SNAP,
Right.
which is 571 cases.
Okay.
And that's not talking about adult financial
Yeah.
and TANF. So on top of, that's all in that same group.
Yeah.
So anyway, what the big change is coming in FY '27 is that work requirements are going to hit Medicaid for the expanded population. We don't know who yet that's going to affect out of that 700 plus people. We also are gonna have to start doing redeterminations every 6 months instead of every year, so that doubles our workload for that. Yeah. In addition to all of this, just to kind of put things in perspective, we have new work requirements with SNAP, then we have Medicaid work requirements that are starting, and they are not the same. So, they will not translate over. The only thing that translates over is that if a SNAP recipient meets the work requirements for SNAP, they will be eligible for Medicaid. They will have, they will meet the Medicaid work requirements, but it doesn't go vice versa. So,
The SNAP ones are more stringent.
yes, they are. And this whole formula thing, like, because our minimum wage is double the federal minimum wage, they only have to meet half the hour work requirements with Medicaid, where that's not the case with SNAP, it's not tied to the actual wage. So it's just another complication we gotta figure out.
New levels of complexity
Yeah.
every.
Okay, and,
Sorry.
Yeah.
Real quick. I had a question.
okay.
Okay, keep going. I had a really, okay,
It's
shoot.
it's overwhelming, it really.
Yeah.
Well, we've been hearing about it since a long time.
Yeah.
To be reminded, you know, this is
No, let's definitely put more money into detention centers and less into this.
So,
people over potholes.
yeah.
Let's plug in videos.
So one of the things that's kind of also concerning and tying back to error rates is currently the state has a 3% error rate with Medicaid as well, which is really low.
Mm-hmm.
Like, that's, I mean, even with SNAP, we have one of the lower SNAP error rates across the nation. So kudos to us, but still not recognized. The thing is we're at the 3% threshold, that moving forward in 2027, they are going to require a match, it's not gonna be a match. They are gonna claw back funding from states if we exceed the 3% error rate. So this is for Medicaid. So if we have an error rate above 3%, they're gonna come up with the amount of money that they paid the state that essentially they shouldn't have paid us because we made an error, right? And they're gonna claw that back. Currently, what's in place is you can do like a good faith waiver, like here's the corrective action that we're taking, don't make us pay back money, and they haven't ever made us pay back money. They have taken out that provision to be able to do that before. So, fun. Lastly, one of the things that's not on here that I just wanna note is that as people lose access to Medicaid, we only have so many options to provide them. One is to send them to the exchange, so Health First Colorado, Connect Colorado,
Which is gonna be
Obamacare.
skyrocketing. 'Cause
Yes.
ACH.
we are already seeing a 30% increase in premiums, in most regions for that,
84 for us,
right?
yeah, just like, just.
Ta-ta,
43, excuse me,
thanks,
it's gonna be 42.
I need a hat like that. Anytime.
Thank you guys for all your hard work. It's it sounds so doom and gloom, but it really did, like, learning more about all this completely pivoted me from like, I wanna fix all our roads to people come first, you know?
Yeah.
So, I'm with you, I don't know what to do.
Start the
'Cause
bucket
it's
for, start the bucket brigade for potholes.
There
I'll
you
be
go.
down,
Yeah.
yeah.
Okay, see you guys.
Sorry, 143% on the on the exchange,
Okay,
is
great.
what they anticipate for Lake County.
Yeah.
143% increase. For Custer, it will be 283%.
Totally in the budget.
Totally in the budget. We actually have the lowest increase of the 7th district. Anyway, sorry.
Yeah,
Tell us-
no.
yeah, so that's kind of stuck.
It's like, well, the county can't afford it and families can't afford it, right?
Nobody can afford
We're
this.
sending them to the exchange, cause that is basically our only option for insurance purposes.
Yeah.
One of the things that we're going to do is have Dr. Lisa come and talk to our staff, because Dr. Lisa's model of being like a concierge type of doctor, where she doesn't depend on, insurance or take insurance, is going to be an option for folks,
Mhm.
right? And,
It's gonna be the cheapest.
yeah,
Care Clinic's also, or sorry, Elevated Community
Yeah.
Health is also launching an initiative like that.
it's just,
Meanwhile, our hospital thinks that the market is gonna respond. And the market is gonna create all of these health plans that will make up the difference for the loss of the ACH tax credits.
okay,
So good luck to everyone.
great.
Great, I like that idea,
Yeah.
Laura, that's great.
So we're just trying to figure out options for folks. We know that people are going to be frustrated with our team. We're the front facing. When somebody loses their benefits for some reason, we're their first phone call. And not a lot we can do about changing that situation other than trying to find other options. So,
When you talk to people, are you going to say, sorry, because of House Bill blah blah blah, House Bill 1, this was changed, and while you were eligible before, you are no longer eligible because this was changed at the federal government.
the state is giving us talking points.
Okay, awesome,
Yes.
freaking love that.
So,
Still doesn't make anyone happier to
No.
be talking to you about it.
No, but just to be clear, because I think to be on the front line and be like, I don't know, there's so many people in customer service, what you're doing as customer service.
Yeah.
In customer service where it's like, it's not their job, they didn't make any of these decisions.
no.
But to be clear about who did make the decisions that are impacting their lives, I'm just glad you're gonna have something you can say.
Yeah, so, but we also know that the messaging from the state is usually pretty terrible. So,
Yeah, do what you can.
we're gonna take that messaging.
Yeah.
Yeah, rework it
Yeah,
a little
good.
bit.
Edit.
Um,
Make a lot of money.
we'll bring this off there.
Yeah.
Yeah. Alright. We good? Moving on.
No, we're not good.
Other issues on the horizon. So, our lovely CWAC, yes.
You told me to start joining now that I'm not just like
Great.
warming up calendar.
CWAC?
CWAC,
I thought it was Colorado Workforce.
no, well, there's two.
There are two CWACs?
There's a CWAC and a WAC.
Yeah.
WAC is, yeah, and there's a CCAP.
Yeah.
There's a WAC and a CWAC. Yeah. I get them mixed up. Okay, sorry.
Okay, yeah. So, the
CWAC.
committee, for those that aren't used to that terminology in the room, they have come up with a new formula of distributing the federal funds and state funds. And we are looking at a reduction. Do we know what that looks like? Well, the first smash at it was about $35,000 of a reduction. So we get collectively amongst all of our allocations for child welfare about $744,000 a year. This would hit the big distribution, which would be $666,000, so taking about $35,000 off of that, starting in 2020. I hope not 2026. But I haven't been able to plan for it because I don't know. So one of the weird things that they're doing is, and I'm happy about this, I just don't know how they're gonna evaluate it in their formula, but they're taking into account case complexity.
Mm.
And I don't know how they're gonna actually do that. And that's actually been the holdup of making the final decision, is figuring out how to do that. 'Cause you have a bunch of numbers people trying to figure out subjective things,
Yeah.
which doesn't work. But I know we're going to hit a decrease, in child welfare funding. I just don't know what that extent is going to be.
Do they know when they're gonna finish developing the formula for the complexity?
So I believe they're shooting for February. Oh, the formula for complexity.
To apply
That
to
could
the
be in the
new-
next, month or so.
Yeah.
They're
pretty close.
yeah, but for actually programming the formula, I think they're shooting for February. So yeah, that should be pretty interesting, how that'll shake out. One of my big concerns though is, and I've been transparent about this, our child welfare cases are no bueno. Yeah, it's and I perceive 99.9% for sure that we're going to have more of these issues the more that there's economic stress on households.
Yeah.
For a couple of reasons. Well, part of it is just resources low, is stress, equals stress, right? It's stress in our own households when resources are lower. But also with DV situations, it's more of a strain too of being able to divide themselves from the DV situation that they're in if they still have financial dependencies on the second individual. So
Yeah.
I'm worried about child welfare, and just staff being able to manage what we have, and what is expected. We talked about underinsured or uninsured already, and then we do have shrinking, I preface it as shrinking funding for childcare assistance. We finally have our slots filled
Mm-hmm.
with
Great
Bright Start, so that's great. Made staff change, whole new world.
Yay.
So that has been good, but the thing is the state of Colorado did not implement the new provider increases that the feds put in place 4 years ago.
Mm-hmm.
And so now we're having to catch up.
Mm-hmm.
So we're in year 2 of a catch-up period. So our distribution of those funds, how much of our allocation we get is not growing, but the provider
Fees
are growing.
Yeah.
So that's just shrinking.
We only have 2 slots in this county, right?
We have 2 slots, but we have 4 kids enrolled in CCAP.
Cool.
And we're exploring,
Is that split up between the 4, or how do you, or was there extra not being used in other counties? How that
no, so we are actually one of the very few counties that have slots. slot contracts. Yeah,
Oh,
actually, I think we're the only one left that has slot contracts. Slot contracts are used to help support childcare providers to ensure that they get paid whether a child is enrolled or not,
right,
right? Most counties, they have like wait lists for CCAP, right?
Yeah.
So they don't have trouble filling a slot, like the provider's always getting paid. Well, we have had those 2 slots.
Yeah.
I'm not gonna go into the administrative challenge of those 2 slots, but what I'll say is we have now
why not?
4 children supported by CCAP that we have the budget for. Does that
Cool.
help?
I mean, yeah, you just said it using different words. I get it.
Okay, there we go.
Good job, Kels.
Alright, these were the goals that I did not write, I inherited.
Question,
Yeah,
why couldn't you change these goals? You
we,
don't need to, why?
well, these were what were given to me. My goals,
By the previous DHS director?
no.
What?
Lauren,
Lauren?
Yeah.
You couldn't change them?
Well,
She hasn't
we're-
been here for like 3 months.
We're reflecting
5 months.
on what they accomplished in 25, and even though she had left, this is what they were
I
working
see.
on.
yeah,
Oh, these were your short-term goals,
Yeah.
not setting of your next short-term goals. Got it. Okay.
my next short-term goals, not mine, the department's,
Our.
next short-term goals are to do and meet and exceed the metrics of the state.
Good luck.
It's gonna be a lot more, this is what the state is requiring us to do and this is what we will be doing.
Mhm.
So,
Got it.
the state requires us to be at 93% timeliness, with SNAP and Medicaid, we're at 100. Okay?
Mhm.
However, we did dip in September to, I think 93%. If we have one application that's not timely, it drops us by 15 to 20% point because we're so small,
Yeah.
right? So yeah. So we're keeping an eye on that. But these are things that we've worked on. They're okay goals. I just think they're fluffy and frilly and we just need to get back to basics. And I spelt a word wrong.
So back when we were chatting, like in the middle of the summer,
Yeah,
sorry, I'm just connecting some learning.
yeah,
You were saying that the funding that we get from the federal government will not just be driven by our rates. It will be like all of us together, all of the different departments of human services around the state will determine the state's
yeah,
rate.
Yeah.
And so even if we're crushing.
Yeah.
If other counties aren't, we will still be impacted. So we're all trying to pull our own weight, even though if we're doing great, it might not necessarily keep us out of the,
correct.
okay, thank you, okay.
The thing that we are pushing for as counties, as directors, is that as these negative impacts regarding like error rates and that kind of thing gets implemented, that the state really needs to be able to drill that down county by county. So that Lake County's not getting a 10% match on SNAP when we have a 6% error rate, right? Like, if it is Larimer County that is driving everybody's percentage up, then that should be the county that's having to pay in the most amount of money.
But the federal government is looking at us all as one state.
They are.
So wouldn't we all get the 10% match even if we're not?
What happens is the state says, the federal government says, state, you have to come up with this 10% match.
Right.
then the state says, okay, counties, we need X percent, we need you to come up with this 10%.
Mhm.
It's up to each state by state how they respond to that match requirement. So some states, because they don't have Tabor, can say, okay, we can pay for it out of our general fund.
Mhm.
We don't have that option.
Right.
So the state will have, we're trying to get them to come up with a formula
Mhm.
of charging counties that are underperforming,
Mhm.
which kind of pisses me off too, because we were, underperforming,
Mhm.
and those are the counties that usually need help,
Right.
rather than like more resources taken away from them.
Yeah, it's the same as schools.
Yeah, and so it just makes me, it's a tit for tat, but I also don't want us to end up in this scenario where we're having to pay a high match when we're doing great.
Yeah, but then if 10% is applied to the entire state by the federal government as a match, you have to come up with that funding, and if it has to come from the counties, then potentially counties that aren't doing well will have to pay 20%
Correct.
match, which is
Also terrible. Yeah,
there's no
Good way.
good way out of this
Yeah.
CF.
yeah, I think for me, it's this weird balance that I already know the counties that are driving that error rate so high is the higher populated counties, right? And so having them, even if they get, they have more resources, right, to pay for this,
Yeah.
right? They have more strings to pull, we don't.
Yeah,
So, I don't know, it's difficult,
I hear you.
but yeah, so
So that's what we're waiting, that's the algorithm we're waiting for, what's the funding equation?
that's for child welfare, that's the,
This is a different equation
yeah, this
we're
is a
waiting
different
for.
equation, yeah, this is for SNAP.
Yeah.
Okay, alright, so, data-driven decisions, this was something really driven by the advocates and nonprofits in the community, just us not sharing information with them,
Yeah.
and we do. So, anything that has come across my desk in terms of like data we're getting from the state, like we have 70 families that may be impacted by these new SNAP requirements.
Mhm.
I sent that out to our nonprofit partners and like, look, just as soon as I'm getting the information, I'm sharing it, right?
Yeah.
So that tone has really changed in the community just in general. I was
Yeah.
like, that's a low hanging fruit. So, and then increasing SNAP participation. This is something that we're gonna need to talk about at a county leadership level, is how much can we afford if we need to start paying a match on SNAP? Can we afford if we got, which will never happen, but if we got 100% of those that may be eligible on SNAP, can we afford an additional 100K on top of the 100K we know we're going to have to pay? So, because that kind of dictates a little bit of our efforts in terms of outreach, unfortunately.
I mean, I feel a little differently about that. I feel like you get everybody on SNAP who should be on SNAP. And
Yeah.
then we figure out how to pay for it.
Well, and that's what we need to know,
Right.
right?
Well,
That's what we need to, that's what my department needs to know,
Yeah.
is like, can we rise to that occasion?
Yes.
And is that going to be people over potholes?
Yes.
Okay.
Well, look, I'm one of
You're one of three.
3 of us, can't tell you much, but
Yeah.
yes.
Yeah.
From me, resounding, and I think Andy is pretty clear on that too.
Yeah. And that's what our department would like to do. I just,
Yeah, and we have room.
Yeah.
We have room in our mills to.
Yeah.
Make sure that people are fed.
Good.
I'll fight for that all day, Laura.
I'm a public administrator, I work for you. So whatever,
Yeah, get people enrolled.
okay.
Let's go.
Alright, and then we are enrolled as a Medicaid provider.
oh, BT Dubs, they won't be able to buy dessert anymore with that money. But we're
Did
gonna
it
get
actually get?
Soda.
We voted for it, no, it did not, I'm just saying, there are plenty of counties who really wanna manage that
But
hard.
I don't wanna know.
Don't wanna know, it's not happening, don't worry.
Okay, alright, we are a Medicaid provider, DHS is. We have to be a separate Medicaid provider than public health, cause we do
Obvious.
separate things. Yes.
Wait, hold up. Sorry, it's just me, I'm gonna ask all the questions. What do you mean you have to be separate?
Cause
Why?
you get enrolled into different, like, buckets of Medicaid.
Yeah.
Like, we're more of like behavioral health. They are more clinical stuff.
Why doesn't it all live under one?
No, it just doesn't, cause they like to make things difficult.
Okay.
So this was one of our goals that was set forth by previous administration. We have done that, however, we went down that path because there is an opportunity potentially to help pay for high fidelity wraparound services.
Cool.
Mm.
Oh no, cool, bad, cool.
But the state went through this huge transition, make sure I'm on time. State went through this big transition mid-year, decided how they were going to pay for high fidelity wraparound, like what the rates would be. It's only going to be $1,200 per family enrolled per month, which doesn't pay for a person to administer the program
Okay.
or any of our administrative costs of.
How many people would it be? Like, how much would that how many families would it be and how much money would it
We're
actually
talking about, it would be about 8 families a year, so 1,200 times
12 times 8.
times 8 is
It doesn't pay for a person?
not with, on top of our administrative stuff. So we
Oh,
would be
like
billing,
benefits and
we would be billing Medicaid at that point. And I don't know what that would look like from what our finance department would need to do that. It is not a closed book. Okay? What has happened is Larimer County has gotten a HICPUF grant to explore, well, not explore, but to become a Medicaid provider like we did. But they are taking it to the next level of learning what all DHS could build with Medicaid from a behavioral health perspective,
Cool.
which was the question mark that we had. It was only focused on high fidelity wraparound. Prior to me being here, I'm like, well, we do a lot of other things, what could we do? The other piece around high fidelity wraparound is we were going to have to hire a clinician to sign off on all of our work, which is similar to what she does, but we can't have a Dr. Lisa that does it for $100 a month.
She does it for free.
Okay, there you go.
I mean, we pay her a lot of rent, but she does that.
Different bucket.
Yeah, so,
Okay.
yeah, so we're piggybacking on Larimer,
Kind of watching them,
Yeah.
seeing what the options are.
collaborating with them this year to
Yeah.
figure out like what are the options that they're looking at in terms of being able to bill for Medicaid and taking that back and seeing what we can do in the future. Yeah. So, we just put a pin in that a little bit.
That's fine.
Skip
You're
one.
enrolled. Like,
Yeah, yeah.
that lift is done.
Yeah, that lift is done,
Awesome.
which is hard. The one thing I forgot is we do not have any additional funds for our vulnerable adult program, which we usually like pair up with APS. We've been working with ARPA funds that are winding down. This is not a statutorily required program. It is a great program. However, we're so focused on a lot of other things that this has been something that has not been a focus, which really stinks. We need funding for older adults in our community, whether that's going to more to the senior center or to DHS to do this type of work, but this is not something that we have achieved this year.
How many people would we be serving with those
It's
services?
not a lot,
Okay,
we're talking about
like 20?
previously,
Like 60?
about 8 a year,
Oh,
yeah, but it's intensive case management,
totally, yep.
yeah.
And that's not provided for by a health provider? Health insurance only? Okay.
No.
Why not? Why
That's a
wouldn't?
great question.
Thank you so much, Laura.
Because health insurance agencies, like say for instance, they're enrolled in Medicaid,
Yeah.
right? And they work with our case management agency for this area, which is Rocky Mountain,
Yeah.
right? Rocky Mountain can only refer them to services that are in our area. Well, if you don't have services in your area, while Rocky Mountain can pay for it,
They can't, yeah,
yeah,
they can't connect you to the service.
correct. And we have the same problem.
So what, I mean, even if we had the money for the caseworkers, it would still be the problem of not having the services for
So
adults.
one of the things with caseworkers, though, is we drive them everywhere.
Oh,
Yeah.
that's the difference.
Yeah,
Okay.
like Rocky Mountain can set people up with Medicaid rights, but that's pretty difficult for our area as well. But like our APS team / vulnerable adult folks have taken people to doctor's appointments, sat in there with the doctor's appointments just to like listen to what, we've had issues where, people with dementia are hearing stuff from their doctor and it's just gone,
Yeah,
right?
totally.
So things like that, it's just a higher level of case management.
Yeah.
It's a program that I want,
Yeah, I get it.
whether it lives with us or with a senior center in the future or something to that effect,
Yeah.
because as we have more of an aging population, we're seeing more and more of a need for that.
Mhm.
But it's not covered by our allocations. So,
Okay. So is it that other counties provide all of that through the general fund?
other counties don't do what we do.
They don't. Nobody provides that.
But there's
These-
other counties that probably may do a similar program, but we are unique. Yeah.
How many cases per caseworker would it be?
So,
Just trying to understand that.
yeah, it just depends on case complexity of
Sure,
it.
Yeah.
I mean, for an APS worker to get beyond a 4 case load, right? That's a lot, cause APS is different from child welfare. You are doing a lot more, it's less of instruction and more of actual hands-on
Hands-on.
work,
Yeah, okay.
right?
So that would be 2 caseworkers
If we were to
if we
do
were to
some,
do it.
something like that, yeah, which is a lot of money.
Yeah.
Yeah. 170,000. Yeah.
Maybe a little more.
That's pretty
Just
close.
pennies. Yeah.
Yeah, yeah.
And administrative costs.
That's about it.
Okay.
Alright, enhancing language access. We now have 60%, I think, of our staff are bilingual.
Wow.
We have some areas that as we do have staff turnover, we want to always be recruiting bilingual staff members. That's always, since I've been in a higher up role, that's been my goal, if we can. And so, hoping to have in the future more people in child welfare that are bilingual. The big challenge with child welfare is that you do have to have a behavioral science degree to be a child welfare caseworker, which is one of the challenges that we have in finding a bilingual worker to step into one of those roles.
Harry, I'm so sorry we're going over. Harry, I'm so sorry we're going over. Are you okay? Okay, thanks.
Yeah.
So since you're here.
Yeah.
There was legislation proposed for 2026 that would cause counties to be allowed to use electricians who were not fully certified master electricians to do their electrician building inspections.
Yeah.
But instead to use people who are like well certified but not at that master
Yeah.
level. Do you feel like there are certifications or compensatory educations that could like fill in that caseworker education that we could be lobbying the state to be like, hey, can we have caseworkers who are qualified in these things even if they're not meeting the mastery level?
So the problem is this is a federal.
Ah! Ah! Okay, so I just have to ask the federal people. That's
But
also not realistic.
I will say we've gotten some leeway around degrees. Like you have to have a bachelor's degree
Yeah.
as a basis. But I have 2 staff members that have bachelor's degrees in public administration,
Mhm.
which is not like a social work degree, but we've been able to get them through.
Okay.
And part of it is just because their work has been in social work essentially
Yeah.
since they started their careers. But it really stinks. It limits, like we have a bilingual case aide
Mhm.
that helps out with child welfare and APS. She can only see in the system read only. She only has read only case access. She can't put in her own case notes or anything just because she doesn't have a college degree, which I think is a bunch of, yeah.
Go
So-
on.
Mhm.
Yeah.
So, I wish that would change, cause I mean, for wraparound too, I have 2 staff members that don't have college degrees that I can't get them into the actual system
Yeah.
to do core services that way. They have to lean on, John, who's gonna be going through child welfare training, who's so crazy, just to be able to input their activities into the child welfare system for core services.
Wow.
So, yeah. Yep, okay, we're moving on. Here's our long-term goals. These are also going to change and be very blanket of we are here to do our jobs.
Core services.
Any questions? New goals. I wrote new goals. Ha! I did. I did this on vacation.
Bad.
Okay, timeliness measures. We already talked about the things that I'm
You're
already
at
talking about.
100%.
Prescribed goals that we're already given and are going to be given more now with error rate reduction. We wanna develop communication plans, knowing that the state communication is gonna be horrible about all of these changes. And then continuing to identify administrative efficiencies, because I know that we do not have infinite funding for, I have a huge department, right? I know we don't have infinite funding for, I would rather money go towards direct program services, right, always.
Right.
And,
Oh, not your
wrong
computer.
Harry, any lasting questions?
No, I know.
Okay.
Thank you.
Questions, new person, Rachel.
That was very inclusive, thank you very much.
Okay. Anytime you wanna visit, 735, we're,
If you want to take our tour down once we finish budget sessions and taking people on tours next week.
Which will come to the 17th then.
Yeah, Justin took me
Justin.
when I started.
perfect.
Yeah.
Laura, thank you so much.
welcome.